Hi, welcome, and thank you so much for your interest in an internship with Leading Healthcare of Louisiana. My name is Leah Boudreau. I'm the Director of Human Resources for Leading Healthcare, and I'm excited to tell you a little bit more today about what we do and why we do it and the opportunities that we have for you as an intern. Leading Healthcare of Louisiana was founded in 1997, and our mission is to make a lasting contribution to society by helping people live a better life. We accomplish that through in-home personal care. Our clients, the people that we serve, are people who are elderly or have developmental disabilities. Now, our caregivers, we call them DSWs or direct support workers. They are the hands of Leading Healthcare. They're the ones who are actually going into the homes, providing the personal assistance to our clients with the aim of helping them maintain their independence and stay thriving and productive within the community. So some of the duties that our DSWs do on a daily basis, they help our clients with things like bathing, dressing, toileting. They'll give medications. They will help to prepare meals, assist them with consuming their meals. They'll do some light housekeeping, some errands, and of course take our clients to community outings to keep them engaged and interested within the community. As an employer, we strive to attract and develop caring, compassionate people that exemplify our company values, and those are trust, compassion, integrity, and accountability. You'll see them on the wall of our offices. You'll see them on our strategy communications, our goal setting every year, and we take them seriously because trust, compassion, integrity, and accountability are the values that we've defined as an organization to be of the utmost importance to us. We've got locations all over the state of Louisiana. We cover really essentially all of the state, everything that you see in blue here. Our corporate office is based out of Lafayette. And then from there, we've got branch offices in New Iberia and Opelousas. We've got a Region 6 office in Pineville with a branch in Marksville, a Region 2 office in Baton Rouge, Region 3 in Thibodaux, Region 9 is Hammond, and Region 5 over to the west part of the state is Lake Charles. So from those 9 offices, we serve over 1,000 clients in the state of Louisiana. We are a very large private in-home care provider. So we've got intern opportunities at really any of these 9 sites, depending on where that intern lives and where they're interested in working. So I want to talk a little bit about home care. You know, a lot of students aren't familiar with home care. They go to school and they say, you know, I want to work in a hospital. I'm familiar with nursing homes. They're familiar with other aspects of healthcare, but maybe not necessarily home care. And home care is an industry that has doubled in size over the past 10 years, and we expect that it's going to continue growing. The delivery of the long-term care services that we provide has shifted from institutional settings like nursing homes to the private homes and communities where we serve our clients today. We're seeing more and more people that want to be comfortable in their homes. They want to stay home whenever they start aging or they've got a disability or something that requires a little extra help. Everyone is more comfortable in their own homes. And so that's why we do what we do, to keep people living independently and stay in their homes. So in the coming years, we expect that because of the growing population of older adults, you know, we talk a lot about the aging population. By the year 2050, the population of people over 65 will nearly double. And so as you can imagine, that's going to create even more of a demand for the home care services that companies like Leading Healthcare provides. So why a career in home care? Well, simply put, home care is one of the top 10 fastest growing occupations. It's an industry that is thriving, even in, you know, current times of pandemic, natural disaster, you name it. Home care is still very necessary and still operates during all of those trying times when maybe other industries have slowdowns or layoffs. So a career in home care is really a great opportunity. In regards to the internships that Leading Healthcare has available, our interns, they really have the opportunity to do a variety of things, and it's going to depend on that intern's interests, what they want to do, what their career goals are, and what they'd like to experience, as well as the need of the office that they're going to be working with. Each of our offices range in size. We've got smaller branch offices, and then of course our larger corporate office and some of our regional offices. So just depending on what the needs are, and again, what that intern is interested in doing, some of the things that they may work on would be records auditing, working with our QA, quality assurance department, assisting the front desk, helping out with new hire orientation, teaching the incoming caregivers into our organization, assisting and shadowing with client home visits. So actually getting to go out and meet our clients in their homes, going along with the client care managers for ride-alongs, doing filing and clerical work, really seeing our requirements from a state licensing perspective. What are the timesheets? What are the client binders that we're required to keep? Observing and assisting with staffing. A large part of what we do is actually staffing the caregivers to work with the clients in their home. And so the staffing component is extremely important. Employee communications, talking with our direct support workers, sending out broadcast messages to them and reminders. And then client progress note review. Again, looking back at the services that Leading Healthcare has provided and ensuring that everything is as it should be. Our hours for the internships are flexible. Depending on what that intern's schedule is, we respect the school schedule and any other obligations that they may have. Our office hours are 8:30 to 4:30 Monday through Friday. And so depending on when that intern is available, we'll come up with a flexible schedule together and set that as their consistent hours. We will offer a stipend of $7.25 per hour for interns that come from programs that allow us to pay. Of course, there are some college programs that request that we don't pay the intern for fairness across the board, but for those that do allow us to, we will offer a stipend of $7.25 per hour. And of course, there is the potential for full-time employment following the internship, and that's one of the most exciting things about what we have available here. Is that our interns have the opportunity to continue their career with Leading Healthcare past that internship and become part of our administrative team at that point if they choose to do so and if they've met our performance standards. So what does that look like? What are some of those career options that are available? Our interns in the past have gone on to become client care managers, staffing coordinators, field supervisors. Those are all people who are directly involved with managing the care for our clients and managing the schedules of the staff that are going to go and work with them. They work in human resources. We've had some work in accounting, direct support workers. We've got registered nurses on staff. Recruiting, quality assurance. Those are all areas that someone who is joining our organization has the opportunity to grow in. And we are an organization that is heavily focused on growth, both from our clients and a personnel perspective. We're always trying to grow and develop our employees, and that includes our interns for those with the potential of advancing in the organization. A common question that we get is, what are the educational backgrounds that our employees have at Leading Healthcare? What does it take? What are the requirements or the qualifications for a career in home care to become a client care manager or a staffing coordinator? And it's really diverse. We see people with a lot of different educational backgrounds. There's really no one size fits all in terms of what works. I think more important are the skill sets and the compassion that that person is bringing to the table. But common educational backgrounds that we see and that we've hired in the past are healthcare administration, psychology, child and family studies, sociology, business, counseling, education, social services, and behavioral science. We also see kinesiology, elder care, and a variety of other degrees and educational backgrounds that are a part of our organization. So again, there's really no one straight career path. Depending on that person's background and what they've learned in their studies, they could absolutely be a fit for our organization. And lastly, we're a great place to work. Our employees love what they do. They love serving our clients, and that's at the heart and soul of what it means to be a part of Leading Healthcare. It's the compassion and the caring for our clients is why we're all here. So you can see a couple of photos here of different activities that we've done with our clients and our staff. So it's just a great team to be a part of. If you'd like more information, you can visit our website. It's lhcla.com. You can email the HR team at jobs@lhcla.com and find us on social media. We've got a Facebook page as well as LinkedIn where we keep all of our job postings updated. We're very active on social media, so please give us a like or a follow, get involved with us, and stay connected. If you have any questions, please reach out, and I look forward to speaking with you about internship opportunities with Leading Healthcare.